Hello, good afternoon, guys. Today, welcome to Nurse Talk. We are going to be discussing an issue about the impact that COVID-19 had on nursing. We're going to start out with the icebreaker and introduce ourselves and say where we want to be whenever we graduate. So I can go ahead and start. My name is Haley. I plan on going into a trauma ICU when I graduate, and then furthering my education and becoming a CRNA.
My name is Cheyenne. I plan on going into the ER when I graduate and then eventually becoming a sexual assault nurse.
My name's Nice. I eventually want to go into the ICU or ER and then do travel for a little bit and then go back to school for anesthesia.
And I am Linda, and I have absolutely zero desire to be an OB or PEDS after this semester. However, I do want to work with older people, and I'm going to start out in the med-surg if I can get a lot of valuable training there.
Absolutely. You see everything in med-surg.
That's true. That's what I want to see.
Well, my name's Frida. I'm the whole opposite. I do want to do OB or NICU. I don't know yet, but then I want to go back to school and be a nurse practitioner.
Nice. So, we are going to start out with a scenario, and I think Frida is going to dive into that more deeply.
Okay. So Lauren is a dedicated nurse who has been working on the front lines of COVID. For months, she has witnessed the devastating toll of this virus firsthand, comforting patients, supporting their families, and providing essential patient care. Despite her commitment to her patients, Lauren finds herself overwhelmed, struggling, and with her mental health. At the beginning, she felt a sense of purpose and determination. However, as the weeks turned into months, the demands of her job began to take a toll. She is haunted by the faces of the patients she has lost, the overwhelming workload, and the constant fear of contracting the virus. Lauren was once energetic demeanor has been replaced by exhaustion and emotional numbness. She finds it increasingly difficult to cope with the stress and trauma of her job, often experiencing anxiety, depression, burnout. Sleepless nights are filled with nightmares and flashbacks of her experiences in the hospital, leaving her feeling drained and hopeless. Despite her struggles, she feels guilty for considering seeking help. She worries that admitting to her mental health challenges may be perceived as weakness or incompetence. Moreover, the stigma surrounding mental health within the healthcare profession makes her hesitant to reach out. Her colleagues notice her change of behavior, their concern for her well-being, but they encourage her to seek help, but she still is hesitant to go for help.
Yeah, so I think that was a beautiful scenario. It really is a good depiction of what COVID-19 did to nursing and how our nurses felt during the pandemic. For me personally, I have a few pictures on the next slide I'll show, but I just want to touch on some things here. The fact that she felt increasingly overwhelmed, she felt like she was struggling with her mental health. And then this comment, Lauren's once energetic demeanor has been replaced by exhaustion and emotional numbness. So for me, my personal experience is I was a CNA during the big part of the pandemic, and I can definitely relate to those things. I also was a nurse during the pandemic as well in an ICU, and I took care of my dad. My dad was on a ventilator. His whole process was like a 3-month-long process, but he ended up passing. So I could relate more than anything to all these things that she's feeling, not just with my dad, but with the other patients that I took care of as well. Another big thing that I want to point out is the fact that she had difficulty to cope with the stress and the trauma of her job. I feel like the overarching idea that we have here is that COVID-19 mentally had a huge impact on nursing, and I think that's the umbrella, and then everything else falls under that. And then I have a few pictures that I just wanted to share. That was during the pandemic. This was my dad, the day that we had took him off the ventilator. And then in his last couple of moments, you know, I was able to go in because of my connection with the hospital, to be with him his last moments. And then this is a depiction of kind of like you have your N95, you have a face shield on top of that. It was exhausting to wear, which we'll touch on that later as well. And then in the ICU, it was emotionally probably the most stressful thing I've ever personally been through in my life.
So, it's just crucial that we shine light on these people who put their lives at risk to take care of everyone that was in the hospital. It's definitely overlooked, but COVID took a toll on everybody's lives, whether you got the virus or not, and especially on the nurses that were in the hospital taking care of these patients every single day. It shouldn't be overlooked, the psychological effects that it took on these nurses too. Their mental health was drained completely from the workload that was added on, which is like 13 to 16 hour shifts. I mean, you never really knew. Lack of resources was a huge thing. So nurses are getting more or higher nurse-patient ratios, and it was affecting the care that they were being able to give. Constant fear of exposure, so whenever they go back home to their loved ones, they have to worry about giving that virus to them. And I mean, it's terrible to have to fear for their lives too, and also your own when you're working every day in that environment. And the mental health, it should be prioritized, but it was something that nobody really took into consideration during that time, because we were putting all this effort into taking care of these people and making sure that they were better off than our own.
Yeah.
So let's go ahead and move on to the next.
Okay, so we found a video, a little short 2-minute video on YouTube, and it kind of goes through a day in the life of this nurse, talking about the patients she had received that day and how they didn't have room for them, or they didn't have the resources to care for them, and then how relieved she was when she got home.
Dr. Gottesman and I are on our way to emergency right now.
We're getting our first admission. Patient from the floor that requires to get the ventilator for the breathing machine.
Nurse Elise Isopo is on her 6th 13-hour day this week.
It's very sad, it's very scary, and it's very real in there. Everything you're hearing on the news about people coming in, people dying, it's true.
They've put in sinks on the stage.
North Shore University Hospital on Long Island is so overwhelmed, they're turning this lecture hall into a patient care room. They even turned couches into beds.
With oxygen and suction set up.
Medical personnel constantly worry about bringing the virus home to their families.
My 6-month-old, he just started crawling about a month ago, and he started beelining toward me, and I tried to sneak up to the stairs before he could get to me, but he started crying really bad.
I personally got engaged last Saturday, and my big concern is always taking something home and possibly contaminate my family.
Right now, we're in a patient's room. We're about to turn him onto his belly to help his oxygen improve.
The end of my shift is nowhere in sight. We just got 6 new admissions in another ICU that we just opened.
Finally, at the end of her 13-hour shift, Nurse Elise gets to go home.
Take a nice deep breath. And I'm going home.
But before she can even greet her family, she goes through a strict cleaning routine. First, she drops off her shoes at the front door. In the backyard, she disinfects her backpack with Lysol. Then she washes her hands, her keys, even her ID and anything that could be contaminated, as her family excitedly waits outside to be with her.
I'm proud of her, that she's doing this, she's not being selfish, she's going out there and helping other people.
The health providers and my mom, they're all heroes because they're putting themselves in harm's way.
I'm a little happy that she's home, but I'm sad because I can't hug and kiss her.
All the stress that I felt at the hospital is just already gone. I felt like I was drained and exhausted, and I actually feel rejuvenated now that I'm home.
What a beautiful video. That's a great depiction. You know, we were talking about the mental health of nurses. I think too, it's really important to note that she was talking about how she feels relieved that she's home, but you could tell the emotional turmoil that she had on her face. It still affects people even when they're home. So I feel like that was important to point out. Just reiterating that, we know that the impact of COVID had, affected us widely. Some of the biggest things that I would say were heavy hitters would be the increased workload. So at this point, it was really essential for us to do patient to nurse ratios, and that we see that didn't happen. Exposure to the virus. Denise had mentioned they're constantly worried that they're going to take this home to their loved one. Imagine living with someone who's immunocompromised or a baby. That weighs on you heavily if you were to bring home that virus. It could be detrimental. Mental health issues. We've really hit that home. We know that that's a huge issue, and that's something that isn't talked about yet, but I think it's going to be in the history books. It was really big during the COVID-19 pandemic, and even now we see those long-lasting effects. Burnout. Over 60% of the nurses are burnt out from COVID-19, and this study was done in 2020. I'm sure this is way more prevalent now, but that's a huge number, 60% of nurses. We all know nurses who are burnt out. It's a common theme. And another thing I want to say, turnover, that's another thing that's going to be huge, especially after the pandemic. You're going to have an increased risk for medication errors, falls, pressure injuries, because nurses aren't staying at their jobs longer than 6 months. That turnover rate is really high. Frontline care people who worked in COVID-19, they experienced things like fear, anxiety, stress. You can see this list, it goes on and on. I'm not gonna hone in on all those issues, but we know the effects that it had on the nursing field. And the last thing I wanna hone in on is that healthcare workers experienced an increase in workload pressures during the pandemic. We can't turn down patient assignments. We have ICUs who have 6 critical patients to 1 nurse. We're running out of spaces in the ICU, so these patients who are critical are going up to med-surg. Those med-surg nurses are having to take on a bigger workload. And it's something that nurses, we think of in general, we're not allowed to, or I won't say we're not allowed, but it's frowned upon for us to be like, that's not okay, that's not safe, we can't do that, because that's our job, is to care for people. So that emotionally was a lot for nurses as well.
Just more impacts. Nurses were having to get floated to different floors because of the amount of patients that were coming in, and that definitely gives an unfamiliarity to where they're working in, which can create for an unsafe environment. The amount of resources that the hospitals had to work with was diminished due to how big the outbreak was, especially in New York. You see it all over the headlines. The amount of ventilators that were being shipped in or made just to be able to care for all those patients that got the virus. And we've already touched on this, but the stress on the nurses, it's not talked about a lot, like I mentioned earlier, like the mental health and the stress that nurses dealt with on a day-to-day basis during this whole pandemic. I already mentioned this, but unsafe work environments, the inadequate resources and fear of contracting the virus, the safety precautions that we would go through just to be able to go and deal with each and every patient. I already talked about this too, but the care, it couldn't be to the maximum because there were so many people that were coming in. You having to just do things as quick as possible to make sure that every patient's getting the same amount of time and the same care. let's go ahead and move on.
So I wanted to put graphs so y'all can see the numbers, things that you, Niece and Haley touched on. How nurses didn't feel like they had enough emotional support from their jobs. Like you can see here, 45% reported they did not have adequate emotional support. We need that. If you're going through this pandemic without that, what do you do? You know? They were experiencing anxiety, frustration. You can see 86%, 76%. And all this impacted their jobs. You can see that people left after COVID. They couldn't deal with that mental picture of seeing all these people die, and they're just leaving the nursing field.
Alright, legal issues, this is something that's very interesting to me. COVID brought out the fact that there are federal and state mandates that do give immunity to most healthcare workers during an extreme emergency, like a pandemic. However, COVID was very long, and so there were no protocols in place for it. The standard protocols you have in a hospital for an emergency, they kind of went by the wayside. We ran out of PPE, so people were being asked to reuse PPE. So can you imagine being asked to reuse an N95? You go from one room to another, and yes, maybe in that cohort of patients, you're only treating people with COVID. But let's say one of those people had a comorbid situation. Maybe they had TB, we didn't know it yet. So then you're trying to transmit that to the next patient. And then on top of that, you're wearing these plastic gowns all day long, and they're asking you to go into another room and spray them down, in between patients. How thorough is that gonna be? It's basically just a glorified trash bag, which.
Yeah, so imagine this, guys. Imagine having to go into your patient room. You're spending 30 plus minutes of patient care in a trash bag. You have on something similar to this. You have on an N95 mask. You have on a surgical mask on top of that, goggles, a face shield. It is exhausting just to do that, and doing that for every single room. Go ahead. Yeah.
Being asked to spray that down and then go to another patient, how thorough is that?
Yeah, absolutely.
So no one really, had the capacity to handle all of that. Also, you were talking about nurses being asked to do different things on floors. There was an expanded practice of nurses. And for example, LPNs were being asked to do things that were out of their normal scope of practice. CNAs as well. And they even have a lot of LPNs doing assessments on people, which as we know, that's not typical practice. Some hospitals started nurse apprenticeship programs, which to be honest, I wish they would continue with that. There were limited preceptors available to teach students. So a lot of new graduates were just basically put out on the floor to work as a nurse without having that clinical hands-on experience, which I think is extremely valuable, to have as a nurse. And then again, you have patients that don't have COVID. They are now relying on social media to get in touch with their doctor. Let's say they have a family medical need that they need to address. They have to go on social media to address strep throat, a fever, sprained ankle with their doctor. So they're using FaceTime. How reliable is that, for HIPAA? Right. So those are a lot of different legal ramifications that came into play.
To go along with the legal considerations, there were also some ethical considerations. There was a lot of places they would continue with their care, but they didn't have the adequate resources or equipment to do so. The implementation of a visitation policy. For most places, the only kind of visitation you could do was on FaceTime or Zoom. And then the patients were dying alone. Since nobody could come in and visit them, a lot of times nurses would have to sit in with the patients when they passed. They could FaceTime their family when they died, or the nurses would actually get chastised for sitting in the room for that long just so the patient wouldn't die alone. Diminished safety and quality of care. Again, with the reusing of the resources, they didn't have enough resources, they were burnt out and tired. Imbalance and injustice between professionals. A lot of healthcare providers would refuse to go in COVID rooms because they couldn't risk getting the disease. They were more important than the nurses, so the nurses had to go in the room to take care of it. A lot of times they wouldn't even go into the rooms to pronounce a patient dead. And then surrogate decision making. Because they were in the hospital, if they didn't already have a power of attorney, they couldn't really get one with the legal documentation. So a lot of times that responsibility just fell on the families, and the families wouldn't. Good Lord. The families wouldn't respect the patient's wishes because they wanted to be able to see them one last time in person before they passed.
One thing I'd like to say is some of the legal and ethical crossed over a bit. For example, we talked about ventilators. How does somebody come across the decision? You have two people of equal age, health, stability. They both have COVID. Who do you determine gets the ventilator? Who doesn't?
Right.
So that was a legal question that comes up, and would nurses be prosecuted for their part in voicing an opinion on that?
Absolutely.
So that was something taken into consideration.
Yeah. And then here, you know, the biggest thing here is spiritual care is really important in the healthcare system in general. But during COVID-19, we seen that be an issue. These chaplains weren't allowed to go into these rooms to pray for these patients. So who did that responsibility fall on? It fell on the nurses. So that was a huge thing that we had to go through as well, you know, having to be that spiritual provider for the patients because they were neglected in that sense. They didn't have that spiritual or cultural care.
And the last point that I wanted to talk about is the resources that they created for nurses and for just health workers in general. These are some resources that I thought was like great. These two, the Emotional PPE Project and the Battle Within, are free healthcare, mental health insurance that you don't have to tell your hospital job, like it's just private. And they help you with having like therapists and just you dealing with your PTSD, your burnout, everything like that. And then there's some nurse groups that you can just talk to your fellow nurses who went through all that emotional toll like you. And there's a lot more out there now that we're speaking up and telling them what's actually happening.
So I think to sum up, wow, thank you guys so much for listening to our talk. COVID was a huge thing, especially in nursing. We're gonna see that a whole lot more like in the history books and us talking about it in the future. But we just really wanted to shine light on this subject because it is really important that we talk about what COVID-19 did to us as a nursing profession. But thank you so much for listening and we hope you got something from it. Bye.
Thank you.